Hello everyone, I'm the Professor Chen, or you can just call me Oscar. And today I will talk about the importance of ventilator circuit cleaning and procedures. And I'm from Taipei Medical University at the Department of School of Respiratory Therapy. And previous years I am a respiratory therapist. So that's why I talk about this topic. Okay, cleaning and procedure. So the objective of this topic is first is to understand why ventilator circuit cleaning is important, and second I will talk about the risk of poor cleaning of ventilator circuit, and also to show the basic cleaning procedures of ventilator circuit, especially in Hakesa Group Hospital. Okay, so before that, I need to talk about elements for infection spread. So the most important things is the first part is the source. So this source includes human, which is a major source to cause infection spreads, and including the patients and caregivers and also the visitor, the family members. And another thing is the contaminated equipment, medical equipment, and also like a mattress, pillows, and even medications can be contaminated. So this source can infect the host by the root. So we will talk about the root later. And how about the host? The host means that these patients are vulnerable to get infections. So for example, like diabetes or high age and even immunodeficiency with catheter insertions and or endotracheal tube intubation. So when we focus on ICU, and we can see that the first source is from the patient, and second thing is from caregivers. And the other thing is infected equipment, especially ventilator circuit if the patient use endotracheal tube intubation. Okay, and these three factors can interact with each other. So the first route is by contact transmissions. So the caregivers can touch, maybe the caregiver use their dirty hand to touch the patients, touch the equipment. And this is a direct contact. And indirect contact means that the caregivers use their dirty hand to touch equipment, and other people touch the same equipment, infected equipment as well. And this is called indirect contact transmission. And if the patient use the respiratory care equipment, they may have another transmission pathways, including respiratory droplet or aerosol transmission. And especially aerosol transmission, because the particle size is small, it's less than 5 micrometer. So this small particle size can retain in ICU or can transmit far away, even outside ICU, to cause outbreak. Okay, so so this is for especially for the patient use the respiratory care equipment. They have these two. Respiratory droplets or aerosol transmission. So that's why we need to do the cleaning, especially the ventilator circuit, to prevent respiratory droplet or aerosol transmission. Okay, and another thing is that if we poor cleaning of ventilator circuit, the major risk is to cause ventilator-associated pneumonia, or called VAP. And depends on different epidemiological data, the VAP report to affect 5 to 40% of patients. And it's a wide range because it depends on different country, different hospital, and different ethics of the patients. And but one of the things is common is that if the patient develop VAP, means that the patient use invasive mechanical ventilations, especially endotracheal tube intubation, or use tracheostomy tube, and they develop the new pneumonia after 2 days of invasive mechanical ventilations. And if these things happen, we need to consider VAP. And the pathogenesis of VAP include that the first is aspiration. So if the patient have poor oral cleaning, this can cause the dirty saliva aspirate into the lung to cause pneumonia. And another thing is that this endotracheal tube, some bacteria can form biofilm and coat on this endotracheal tube, and that the patient aspirated to cause VAP. And another thing is ventilator circuit, because usually when we use ventilator circuit, we need to add humidify within the circuit, and this humidify can cause condensed water, and this condensed water sometimes can have bacteria inside, for example like Legionella, and this Legionella, this bacteria can be inhaled by the patient by aerosol transmission. So this is another source to cause VAP. And the mortality of VAP is high, so I specifically find one study in South Africa, and they found that this is a retrospective study, and they found that the mortality rate of VAP was 30% in ICU, in one of the ICU in South Africa. And they also found the late onset VAP means that the VAP occurred after 5 days of intubation, and they found that late onset VAP was associated with higher mortalities, more than 50% compared to early onset VAP. And another study, I think this is conducted by Japan, and they found the clinical impact of VAP is that VAP can increase morbidity, such as sepsis or septic shock, multiple organ failure, and also increase mortality. And another thing is that VAP can increase hospital stay and also decrease ventilator-free day. And another thing is that because the patient requires to spend more time in hospital, so this can increase the cost of care. So this is a limitation or disadvantage of VAP. And another risk of poor cleaning of ventilator circuit include the blockage circuits or this condensed water flow back into the machine and cause ventilator malfunctioning. And another thing is that because we just have few ventilators, and this ventilator sometimes we need to shift to other patients, and if we have poor cleaning, this can cause cross-contamination between patients. Okay, so from above descriptions, we talk about the risk of poor cleaning of ventilator circuit. And next things we'll talk about how to control, how to do infection control. So I divided it into two parts. The first is human. The other thing is equipment. So let's talk about human first. So for human, the first things we need to do is to wash our hand. And this part, I like to mention one thing is that we have dry hand washing by alcohol and also wet washing by soap. And if you directly touch the sputum or blood from the patient, you need to do wet washing at least 40 to 60 seconds. And another thing is precaution. And the first for precaution is vaccinations. So for example, like in Taiwan, we have annual influenza vaccinations. And also for all caregivers, you have hepatitis B vaccinations. Okay, and another precaution for the caregivers is to, if you like to prevent contact transmission, sometimes we need to wear gloves to prevent contact transmission. And in order to prevent respiratory droplet or aerosol transmissions, we need to wear a mask. And sometimes to prevent a splash of blood or sputum, sometimes we need to wear eye protections or face shield. And another thing I like to focus on is equipment. So all of equipment should be clean first. And then according to the levels of item, we need some equipment will require disinfection, some equipment need sterilization. So the benefit of cleaning ventilator circuit is that the first is prevent VAP, and this can save cost. And another thing is that sometimes we can use disposable ventilator circuit to reduce the risk, but this can increase expense. So even in Taiwan, we have disposable ventilator circuit. We also have a reusable ventilator circuit to decrease the cost. So consider the balance between safety and the resource. So use the reusable ventilator circuit is, I think, is one of benefits in this hospital. Okay, so this is just a table from our respiratory care textbook, and they categorize different medical equipment into 3 parts. The first part is critical item, second is semi-critical item, third is non-critical items. And critical items means that this equipment have higher chance to touch the blood of patient. So if you use these kinds of items, you need to use sterilization, okay? And semi-critical items means that this equipment just touch the mucosa membrane, okay? So most of respiratory care equipment, including ventilator circuit or humidifiers, are categorized as semi-critical items. So if the equipment's categorized as semi-critical items, we need to use high-level disinfection. So in ventilator circuit, we need to use this high-level disinfection method. And another thing is non-critical items, means that, for example, like a ventilator themselves, and because ventilator just put beside the patient and just caregiver can touch the ventilator and the patient cannot touch it. So the ventilator is categorized as non-critical items. So it means that they just need to use at least low to intermediate level disinfection. And I'd like to mention one point is that in Taiwan, because we have home care respiratory disease patients, so sometimes for home care respiratory care equipment at home, because they don't have a device to do high-level disinfections, so sometimes in Taiwan at home, we will step down a little bit. So for respiratory care equipment in hospital, we need high-level disinfection. But for home care respiratory care equipment, we step down a little bit to low to intermediate level disinfection. So I think in this hospital, maybe we can start from low to intermediate level disinfection first as the home care respiratory equipment. Okay, so this low to intermediate, especially intermediate level of the disinfection means that this way can inactivate all bacteria, most virus and most fungi. And if you use high level disinfections, means that these methods can inactivate all microorganisms except bacteria spores. And if you use sterilizations, these can completely kill the bacteria spore. Okay, so the following is our team designed to talk about how to cleaning and how to disinfect the ventilator circuit in Somaliland. So the first things we need to do is to disassemble circuit completely. So we disassemble the circuit and put in a box. And remember to have a cover because we need to prevent aerosol transmission from this ventilator circuit. And also we need to prepare mask, gown, gloves, and also bleach for disinfection, and also detergents or soap for cleaning. And the second step is to, because we bring the ventilator circuit to operation theater, and then we use the tap water to wash once. So this is use the detergents to wash the ventilator circuit. And I would like to mention this part is that we not just wash the external part we also need to wash the internal part of ventilator circuit. Okay, so we wash the external and internal parts of ventilator circuit by detergent with water. And step 3 is to rinse completely, especially internal part of ventilator circuit. And the step 4 is that we need to prepare another site or another clean box. So after cleaning, we need to put the clean ventilator circuit into another box. Okay, so we need to prepare one separate cleaning box to put this cleaning circuit after we use detergent for cleaning. And step 5 is to do disinfection. So we use bleach. And this bleach, we use a ratio around 1 to 100 dilution. And this is about the low to intermediate level of disinfection. And we put all of the cleaning circuit into this box, merge in the bleach for about 30 minutes to 1 hour. And after that, this is one of an important part, is that after disinfection, we need to use still water to clean, because if we use tap water again, because the tap water still have some bacteria inside. So if we use tap water, this can also contaminate our cleaning circuit or disinfected circuit. So we need to use distilled water after disinfection. And after that, just dry before reuse. So we hang on the ventilator circuit over here. And this one is humidifier. So we put upside down to let it dry. Okay, and after dry, we need to store our clean or disinfected circuit in the dry cover container, and also label ready to use or already disinfected, and avoid contamination with other medical equipment during storage. Okay, and another 2 things I like to supplement is that the first is how to handle condensed water when a patient is using ventilator. So we need to clean condensed water and avoid aerosol generations, and we need to consider this condensed water as infectious waste. So we need to throw condensed water away into red trash can. Okay, so this is how I demonstrate how to handle condensed water when the patient is using ventilator. So the first thing is that because the patient is on this side, so we need to let the ventilator circuit below the bed of the patient. Otherwise, the patient would aspirate this condensed water. Okay, so this ventilator circuit should below the bed of the patient. And the second thing is that when we like to cleaning the condensed water inside the ventilator circuit, the first step is that one hand is to hold the ventilator circuit, and the other hand is to pull this circuit to let all of the condensed water go inside this water trap. Okay, so the direction is from the patient to the ventilator. Okay, so when we clean the ventilator circuit, just let condensed water go inside this water trap. Okay, and the other tubing is the same. So when we clean the other line, use the same method. One hand hold the tube, the other hand pull the tube to let condensed water inside the cup, and we throw away the water, this condensed water, into the. Okay, and another I like to mention is that when to change ventilator circuit. The first is that at the start of new patient. So every patient need to use a new circuit, a new ventilator circuit. Okay, and another thing is that if the patient already used the ventilator, and we do not need to change circuit daily. So this is according to WHO guideline. But recently, there's no specific time points to change ventilator circuit. So for example, in Taiwan, we change ventilator circuit every 14 days. But this is not the specific time point. But important thing is that we do not need to change circuit daily. And except we find the visible contamination, for example, the blood or secretion in the ventilator circuit, and for us, it's hard to cleaning. If this visible contamination occurs, we need to change the ventilator circuit. Okay, so finally, the take-home message is that the first is that cleaning ventilator circuits equals critical for patient safety, and this can prevent infection, especially VAP, and ensure ventilator function. And cleaning circuit not just protect the patient, also protects ourselves, the caregivers, and reduce costs. So the final word is that the clean circuits save patient. And thank you for your attention.